Have you got a stoma and you're thinking about exercise? Maybe you're wondering, is it even safe? What should I do? What should I avoid? Well, this is the video for you. So this is a presentation that I delivered to a group of stoma patients at a local hospital. And in it I outline the benefits of exercise, but also some of the potential dangers and what you should avoid, and then how to actually approach exercise, a bit of a roadmap. So if you're new to the channel, my name is Hassan Qureshi. I'm an exercise physiologist, and I have been for the last decade, and I've worked with a number of stoma patients in my clinical experience. And this is a bit of a culmination of those years of experience and working with those clients. And so please watch till the end, and if you have any questions, put them in the comments below, and I'll try my best to get back to you. Well, if they miss anything, it's been recorded.
Oh, it's been recorded. Okay.
Cool.
All right. Thank you, Hassan, for coming on.
No worries.
I appreciate it a lot. Thanks.
Thank you. Thank you for having me, and thank you guys all for coming along. Hopefully this is useful for you guys. Okay, so we'll make a start. So this is the game plan for today. I'll go through some introductions, introduce myself. I'd love to hear a little bit more of who's in the room as well. We'll very briefly talk about what a stoma is. I don't think I'm preaching to the choir here, I'm sure, so I won't cover it in any great detail. But really we're talking about exercise and stomas, right? So the benefits of exercise, but also want to touch on maybe what not to do, so some potential risks. And then I want to leave you guys with some practical tips on when and how to exercise. Is that fair enough? So we should have time for Q&A at the end, hopefully. But if you have any burning questions, feel free to shoot your hand up and ask, or if you can just jot it down and save it till the end, because sometimes I'll cover it in the next slide, for example. Is that cool? All right, awesome. All right, so hi. My name is Hassan Qureshi, as Lee mentioned. I'm an exercise physiologist. Anyone know what an exercise physiologist is? Not many. Okay, so I'll talk about that in a second. Glad I did a slide on that. So I've been that for 10 years. And so I've worked across various settings. I started off in an aged care facility, worked across medical centers, and now I've sort of settled into a clinic, which is just down the road on Darcy Road on the other side of Cumberland Highway. Okay, so it wasn't quite a... Sorry? Oh, you have?
Monday, Wednesday, Friday.
Oh, there you go. Yeah, it's not far from Toongabbie. You've seen it. So that's basically where I am at. So as an exercise physiologist, obviously we work with a range of clients. We work with kids and older people and everything in between. Most of our work is NDIS. We have some work cover stuff as well. But one of my special interests over the last 4 years has become stomas. Okay, so I wouldn't say I'm an expert in it, but I've sort of seen probably more stoma clients than some of the other physios and EPs. Okay, and I really appreciate the opportunity for Lee to, for me to come and present to you guys. All right. So yeah, a bit about me there. So what is an exercise physiologist? In a nutshell, an EP is somebody who prescribes exercise in a clinical setting. All right. So not like a personal trainer, because we're working with people that have certain conditions, and not quite like a physio, because basically all we do. That's all right. Main thing that we do is exercise prescription. Okay, so as opposed to the massage and TENS and acupuncture and all the rest that a physio might do. All right, so the next question is, well, what is exercise? And so we define it as any physical activity that can improve or maintain your health. So anytime you need some sort of exercise for health reasons is when you could see an exercise physiologist. That could be lower back pain, it could be diabetes. Okay, so you can see there's very different there, but exercise can help. So just to give you some ideas on exercise, as you can imagine, you can go for a walk or a run, you can lift weights. Breathing is a type of exercise as well. Okay, obviously balance training, yoga, Pilates, those types of things fall into that. Something as simple as squeezing a tennis ball or doing some putty work for some people can become an exercise. Okay, because again, that idea of it's a physical activity that can improve and maintain an aspect of your health. Does that make sense? So it's quite broad. Obviously, lifting weights or manual handling techniques is part of it, and one that a lot of people love is sleep is an exercise. Okay, so all right, cool. So that's a bit about who I am. My goal today is obviously to talk about exercise and stomas, but it's to do three things. It's to educate you on that topic. It's to inspire you to hopefully you walk away thinking, right, I want to do some exercise. but also to caution you to say, right, there's some things that I should probably be careful of. Is that cool? Now, I am an EP, but I'm not currently your EP. And what that means is the advice here is general in nature. It may or may not apply to you in your specific situation. All right? I'm also not a financial advisor while we're doing disclaimers. All right, so that's a bit about me. I'd love to hear about you guys. Now, we've got a few questions coming up on screen. I'd love to hear yeses or nos. But having said that, it might be medical stuff. So if you don't feel comfortable, just sit out. That's totally fine. Is that cool? And then for those who are comfortable, if you can just give me some more context. So the more I know about who I'm talking to, the better I can present. Is that cool? So the first simple question is, do you currently have a stoma? If you do, just hands up. Okay, so most people in the room, some people know. And would somebody be comfortable to share what type of stoma we have? Anybody? Urostomy, okay, yep. Colostomy. Colostomy, urostomy. Colostomy, okay, all right. So mostly colostomies, one urostomy, good. What's that? Oh. Oh, okay.
Mine's Rosie.
Oh, okay. Wonderful.
She's like a little Rosie.
Okay. That's wonderful. All right. Now, do you guys currently perform any structured physical activity, i.e. exercise? Would you say some no's? Okay. Maybe we'll just do a show of hands. Okay. So there's a few yeses. All right. And would you guys be comfortable sharing what that entails?
Yeah, I play the Masters.
Yep.
NRL Masters every year.
Yep.
This year.
Yep.
Like mine out, but
Right.
Fire club, things like Fire club.
There you go. Yeah.
7 times, 111 kilometres overnight.
Right.
Love swimming. All that thing, I swim actually now.
Yeah.
3 on 1.
Right. Amazing.
It doesn't stop like getting out of the water. Love walking, I love walking.
Okay. Great. Perfect.
Keep yourself fit.
Fantastic.
That's enough for everyone.
Yeah. We're tired listening to it. No. That's fantastic. That's great. That's what it's all about, is living life to your fullest. Yeah. Absolutely. Yep. Exactly right. Yep. Anyone else happy to share?
A bit like you might have had a kayak, but it calls 14 years, so I have to give it up.
You park that. Okay, fair enough.
First
Yeah.
time I was trying to grab a clean, too much pressure,
Okay.
and kept on coming off the wall.
Fair enough. Yep. Okay. Anyone else, just quickly?
Yeah, I'm just
Okay. Yep. Would that be like weights and stuff? Okay. Awesome. Yep. Yep. Okay. Yep. Amazing. All right. Cool. So we've got a few people exercising in the room, which is great. Maybe not as many as we'd like, but that's all right. That's what we're here for.
Play squash.
Oh, do you actually? Oh, there you go.
I've got squash compounds tonight, if that's any good.
Oh, that's cool.
So you'll have to go home and talk about a bread.
All right. Wonderful. All right. So this goes for everyone, particularly about people that are not doing as much exercise. Is something that's sort of stopping you from exercising? Is it a fear or concern, would you say? Okay. Hernia?
I have to move on from here over to here where it was here.
Right.
Four hernias. Four.
Right. Okay.
If I transfer from one wheelchair to another,
Yep.
my kayak going like that, but you got to use claw muscles.
Yeah. Yeah.
Me and Joel are neurologists because I have Parkinson's.
Oh, okay.
And,
Okay. There you go. Yep.
I've got fractures in my vertebrae,
Right.
which is really
Sure.
more than anything. So I've just walking in the water.
Oh, okay. Yep.
So the last 2 weeks,
Yep. Good on you. Yep. Great. Awesome. Yeah. And that might be a potential reason for you not doing other things, would you say?
Well, I used to walk.
Yeah.
Walk,
Yeah.
And when the back
Yeah. Sure. Okay. Yeah. Okay. All right. Oh, wonderful. Okay. Excellent. That's great. Awesome. All right, cool. So we're hearing some hernias and some general health conditions, other health conditions as well. Okay. All right. Have you ever spoken to anybody, a health care professional, about exercise, particularly in the stoma space? Anybody sort of spoken to anybody? Okay. No one? Okay. All right. And have you ever searched online for stoma and exercise out of curiosity? No. Okay. Oh, interesting. All right. Cool. All right. Awesome. So, not this.
YouTube, but there's not much on YouTube about it.
Yeah. Okay. Sure. But you have had a look.
The reason for me,
Yeah.
I use that.
Gotcha.
So go on YouTube.
Yeah.
Some information good, some information.
Correct. Exactly. So you want to be careful
Yeah.
of that. Yep. Not a problem. Awesome. All right. So let's move on. So this is just a very basic primer. I'm sure, as I said, you guys know all about this. But essentially, what is a stoma? It's an opening in the abdomen that allows waste to exit the body. Is that cool? We've got Lee in the room, so she'll correct me if I get something wrong here. And so, from what I understand, it can be reversible or irreversible, right? So different terminologies for that. And the surgery, there's different surgical procedures. I think now mostly tends to be laparoscopic or keyhole. Sometimes it might be more open surgery, right? And that obviously has all of this stuff has implications for when you do want to exercise, okay? And of course, as you guys all know, there's different types of stomas. There's the colostomy, which I presume is probably the more common ones. And then there's the ileostomies and the urostomies. Yep. Cool. Yeah. Yep. Exactly. Awesome. All right. So, what are the implications of having a stoma? Life is different. I think that sort of goes without saying. I always say to the people I do work with, like, I know this on a theoretical level, you guys know this on a lived experience level. Okay, so I don't pretend to know more about this than you do, but as you know, it is different. But that doesn't mean that it's necessarily life is over, for example. Life goes on. All right, as we heard, shouldn't stop you from living life. It just means what you do, how you do it, just changes a little bit. Okay, so expect some changes, and everybody's journey is unique. And so that's important because you might be talking to somebody who's, playing the Masters and for 10 years playing NRL. That may or may not be applicable to you. All right. Or vice versa. Somebody who's been really struggling with a lot of hernias, when they do something really simple, that may or may not mean that that's going to happen to you. Okay. But I do feel like it's useful to be aware of certain complications that may arise. Not to say that they will, but it's important to be aware of them so that at least we can start taking some action to mitigate that. Okay, so some of the main complications, and again, remember I'm talking in an exercise sense, would be you've got a weakened abdominal wall. So you've got a hole in your abdominal wall, so it does weaken it, which then does increase your risk of hernias potentially. Okay, people report sort of digestive issues, so whether it's constipation or things with output. So there can be complications at the stomal level. As you guys know, it can sort of come out too far or it can go back in again, or skin level issues can happen, irritation, which I'm sure these lovely ladies can help you guys with. But those are things that do arise oftentimes. It can have an impact on touchscreen. It can have an impact. I didn't realize that. Okay, hopefully I haven't mucked anything up. It can have an impact on your physical activity. So a lot of times, it's in fact I'd say probably everybody probably reduces their level of physical activity after getting a stoma. Okay, and so for obvious reasons, but obviously we're here to talk about how you can increase, and it obviously has a psychological and social impact as well. So a lot of times people will find that they don't feel quite as comfortable, going out or meeting friends and family because of what if something goes wrong. Okay, so those are some things. Not to say that that's going to happen to everybody. You may relate to some of those things, and just judging by the nods, I guess you can relate to some of those things. And
I just asked a question
go for it.
About digestive challenges.
Yeah.
Is it common I was diagnosed as being lactose intolerant,
Right.
so I couldn't have dairy.
Yeah.
As soon as I had the surgery last year, I can eat whatever.
Oh, okay.
Is that normal, or would you know?
Yeah, I'm not too sure about that. Yeah, I wouldn't say. Yeah.
Sorry, I'm standing
Yeah, go for it.
think I'm not a dietitian, but maybe that diagnosis was not right in the beginning because technically for you, nothing's changed until the end. So with lactose intolerance, it's like all the way down, no, it's all the way down, like through the stomach and the small intestine. Nothing there for you. It was further down the pipeline.
Yeah.
So I wouldn't think that surgery would have changed that for you. I think the digestive challenges you're talking about is when you get a high output or you get constipation as a result of eating different foods and things like that. That's more along the same thinking. I think for you, it was not diagnosis in the beginning. Nothing has changed except for
Does that help?
Yeah.
Yeah. Okay. Awesome. So I sort of debated whether I include this or not, but I think this might be useful because hernias are probably the most important thing that come up in the context of exercise. So just very briefly talking about what is exactly a hernia is basically when a part of an organ or tissue goes through a wall that it's not supposed to, right? So you can imagine, you got a little diagram here, you can imagine the sausages up and down, those sort of your muscles, and you've got a little hole there, which is by design because the stoma needs to come through. But then if other stuff comes through, that sort of would be a very rough way of putting what a hernia is. Okay, and that's sort of describing what we call a parastomal hernia, so it's around the stoma as well. Okay, which is probably the most common one that we'd be mindful of. Would that be fair?
Yeah. There's
Cool.
a few different types of
Yeah.
hernias and they bulge into different layers
Yeah.
in your tummy. But as Hassan said, and one of the surgeons that we work with will say as soon as he creates a stoma, he creates a hernia because that intactness of that muscle is interrupted to be able to bring the bowel through straight away.
Mm.
But where it bulges up, it can bulge up between the red part and the white part, and it can come into different areas. So it's just a matter of making sure that you're aware of it and that you look out for different things that may go wrong with it as well.
Mm.
Yeah. And we can wear some support wear to actually try and support the tummy to give back the continuity of that muscle again.
Yeah.
And improve that exercise.
Exactly. So it's one of those things where a lot of times people come to me saying, "Look, I want to prevent a hernia. So what do I need to do?" And well, obviously we try and help them, but I do let them know that there's no necessarily, it's not a fix necessarily, right? So depending on what you read, some people will say it's almost inevitable. There's certainly a very high incidence of hernias following a stoma surgery. So what we're trying to do is help to reduce the risk and improve your chances of not having one, but there is that risk there. Okay, and this is what we're talking about when we talk about hernias. So there's other, so risk factors, obviously having the surgery, and then an important one that we'll talk about is what we call intra-abdominal pressure. So I'll talk about that at more length later on. And obviously there's certain signs and symptoms, and you got some great support at the hospital. So if you're ever unsure, you come and see the nurse or you see a doctor, and then they'll sort you out. Okay, so that's pretty much that slide. All right, so let's moving on to exercise. So here are some benefits because I am here to sell exercise. Okay, so if you're considering exercise, here's what you might experience some positive aspects. So you can improve your core strength, which again reduces your risk of hernias potentially, but also helps you live life. And core strength is very important for moving and lifting things and whatnot. Helps to maintain and increase physical fitness. We talk about fitness as aerobic, cardiovascular. Not being so short of breath when you're coming up a ramp. Your strength, holding a bag of groceries and you're able to carry that. And then flexibility. You're able to, pick up your shoes or put on your socks and things like that by yourself. All right. It can aid digestion and bowel function as well. So that's an important one. So obviously nutrition or diet will play a big role, but moving helps things as well, helps move things along, and also helps you feel good. So there's the psychological benefits of exercise as well. Okay, so lots of good things, and I would always recommend exercise should be included before and after stoma surgeries. Okay, and I say surgeries in plural there because a lot of times the clients I'm working with, they've had a surgery and now they're having another one, i.e. they've got a stoma, now they're going for a reversal. I've got one recently who's now going back to reversal, getting a stoma again because he didn't like his reversal. So
He's the inpatient at the moment.
yeah. So consider exercise before and after, not just after. If anybody here who hasn't got a stoma, also very useful to consider exercise, but certainly after as well. All right. Any questions so far? I know we said we'll take questions at the end, but are there any questions at the moment? You're just laughing at the cartoon. So yeah. So it basically says, what fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? A little bit morbid, but it's the idea to, you want to try and do some exercise. I always say to people, my clients, exercise is a bit like an investment of time. So you put that time in, but then the other 23 hours that you have in the day, you get more out of it. Okay, so it's that return on investment. Even your sleep is better. Your interactions with other people is better. When you're doing ADLs, everyday activities, it's easier. So that's the idea there. So no questions from the room. Here's some questions that I usually get. Is it safe to exercise with a stoma? Yes. Okay, depending on what you're doing, but generally, yes. Can I still lift weights after my surgery? Yes, but there are certain things you want to be careful of, which we'll talk about. All right. What is the best exercise to start with? So absolute start, say breathe, and then walk. Okay, so if you can, those are probably the two best things to start with. Okay. Should I do sit-ups? So we often talk about core strength being really important. So people think core strength, I better do sit-ups. Right? Anyone else had that thought? A little thumbs up. Great. Not such a great idea. Okay, and we can talk about why as well. And then are there any other things I should avoid? Okay, and we'll talk about that. Okay. Anything else that someone's sort of burning to ask? Yep. Yep. Just how to do it, sort of thing, and how to approach it. Yeah. So I'll talk about that at length. Okay.
What about planking?
Planking, yes, it could be okay depending on how you do it. So essentially, when it comes to exercise, so if everyone knows what a plank is. So essentially, the default plank would be you're on the floor, face down, tummy down, elbows and feet. Okay, and then there's different variations. You can have your arms outstretched. You could plank on a higher surface, which just becomes easier. So I could plank on a wall, maybe not this wall. So that's what a plank is. So the difference between a plank and a sit-ups is what we call flexion. It's repeated bending down, up and down. A plank is not. It's still. So could be appropriate. It just depends on how sort of strong you are, sort of thing. Okay.
When I try it, I feel like
Doesn't feel right? Yeah, so then probably not.
okay.
Yeah, okay. And that's the other thing. So today I'm not going to give you a specific exercise program, as much as I'd love to, because of that reason. Because everyone in the room, as you can probably see, is very different. Okay, so I can give you some of the first principles if you like, and some of the what to look out for, but unfortunately we can't do the specific prescription stuff. All right. Here's some things on what not to do. So the most important thing I'll talk about is how to correctly engage your core. Okay, now this will translate to everything that you're doing, hopefully. All right. There's two main ways to engage your core correctly. When I say engage, I mean activate the muscles in your abdominals. Okay. The default way, if you ever go on YouTube and say, how do I engage my core? They'll tell you to brace. And basically what that means is, don't do this, but imagine someone's about to punch you in the gut and you go, and you brace down, right? And what that's doing is it's creating pressure inside of you. It's what we call intra-abdominal pressure, so inside your abdominals. Everything's pushing outward, and that's protecting your back and your organs and everything. So if someone punches me, it doesn't go to my organs because there's outward pressure. My back is protected as well. Okay. The trouble is, if you've got a hole in your abdominals, that might not be the best idea because you're creating outward pressure and there's a hole there. So I don't recommend bracing for that reason. And I say that, and that's really important because anytime if you talk to a healthcare professional who doesn't know this, or if you go on Google or YouTube, that's what they'll probably teach you. It's not wrong for most people, but for this specific population, I would avoid it. Okay? So the alternative is what we call hollowing, which is creating a little vacuum. I always say, if someone's about to take a family photo, you sort of stand at the side and go, you tuck your stomach in. That's also going to activate your abdominals. It's going to also activate your core. To be fair, not as well as the bracing. Okay, so it is a bit of a compromise, but it doesn't create that pressure outward. So I would recommend that for that reason. Okay? In fact, when I work with clients, that's pretty much the first thing we do. We learn that because you guys know it now theoretically. When you start to do it, oh, that doesn't feel right. Oh, my pelvic floor is really on, or you know. So we take our time with that because that forms a foundation for everything else that we do. Does that make sense? So pretty much everything what not to do would be related to the bracing. All right. So here's some things not to do. Obviously, don't do the abdominal bracing. That's number one. Also, don't hold your breath while lifting. So this might be relevant for the lifting. So you'll see sometimes, I don't know if you guys ever watch gym videos, probably not as much as I do, but sometimes people lifting heavy weights, they go, huh! They make that grunting noise, or you see it in martial arts when they punch and they go, huh! And they're creating this, again, that pressure inside, breath holding or the Valsalva maneuver. It's, again, creating that pressure. So it goes back to that bracing concept. All right? So try not to do that. Sit-ups and crunches for the same sort of reason. Okay, but also that movement aspect of your ab muscles, your six-pack, okay, which oftentimes the stoma is coming through, I believe, anyway. Okay. And this idea of no pain, no gain. You know, sometimes we have that old school mentality, got to push past it. If it doesn't hurt, it's not working. You know, it doesn't apply. Doesn't apply anyway in general, but especially if you've got a stoma and if you're doing some exercise that really hurts your stoma site, but you're pushing through, well, that's probably not a good idea. Okay, hopefully no one's doing that. So those are some things that I definitely wouldn't do, and there's a few things that I'd say just be careful of, and maybe do with supervision, or as long as you know what you're doing, you might be able to entertain. So there's not a red cross, but it's certainly a caution. So lifting too heavy, too soon. One of the challenges in my role is I don't want to discourage people from lifting and exercise, but it's always a matter of knowing when it's appropriate. Okay, so it's not that you can't lift, but just not too soon. And so the way you know it's too soon is as you're doing a lift, you're no longer able to hold a hollow position, you're going into a brace. That's generally how you'll know that the lift is too hard for you right now. Okay. So jumping and sprinting and high impact stuff generally would be not recommended. But again, it depends on who you are. So we've seen cases that people do that. So it's not a complete contraindication, but I would say it's a relative contraindication. Wearing unsupported clothing. So what I mean here is if you're wearing really, really tight clothing, if you're a cyclist or whatnot, and you're wearing Lycra, and that's sort of pulling on your stoma bag, that might not be the best idea. Okay, so just thinking about clothing, also thinking about sometimes people wear too much clothing as well. And so hydration is an issue. And then if you sort of got 3 layers of warm clothing, that can also become an issue as well. All right, and then obviously not neglecting hydration and nutrition would be what not to do. Is that making sense so far? All right, we're on the second half of this. So how do you exercise? I break it down into 3 phases or 3 parts, not necessarily in chronological order. It just depends on which part of the process you're at in terms of how far off you are from the surgery. But number one thing I like to do, as I said, is proper core activation. So that starts off with just belly breathing. You guys familiar with belly breathing? Anybody? No? So essentially, if you're lying on the floor, and you can do this at home actually, lie on the floor, put a hand on your chest, put a hand on your belly, and just take some deep breaths and see which hand rises and which one doesn't. So if you're belly breathing like a baby would, you'd feel your stomach or your abdominals going up and down, which is what we'd recommend. Sometimes when the opposite is chest breathing, right, or shallow breathing. So you'll see your chest expand and come down, your belly doesn't move, right? So we want to encourage the belly breathing, the diaphragmatic breathing. So that's, again, this might take a session or 2, you just get that right. And that then goes into abdominal hollowing because now you're learning to use your core correctly. And then we start moving. So cardio, okay? So that's things like walking, cycling, swimming. Swimming is great. Cycling you also have to be careful of just depending on, the height and whatnot. But walking is usually probably the best if you can do it. Okay, and again, walking in water might be a good option as well. Make sure obviously the garments are all there, but that just reduces so you're lighter in water than you are on land. Okay, start small and increase the duration. Okay, So when we talk about walking or we're talking about cardio, we talk about volume of exercise, so how long did you do? But remember, it doesn't have to be how long did you do today, it's how long did you do this week. So if you do 10 minutes a day, at the end of the week, you'll have done 70 minutes. So it's an hour of exercise. So thinking about that, as opposed to let me go do an hour today and then I'll be buggered for the rest of the week, all right? So that's important. Number 3, one thing that I probably really encourage is the resistance training. All right, so I would recommend probably see somebody to get some assistance on this, but start light, progress slowly, focus on technique and core activation, correct core activation. All right, yeah.
What's resistance training? Is that like using bands?
Yeah, good question. So resistance training, literally as the name sounds, it's resisting. So it could be lifting weights. Okay, so that's what we call external resistance. It could be therabands. So it's, you guys all know what a theraband is? Here's one I prepared earlier. So you tie that up to a pole and you're pulling that. That's adding resistance to your movement. That's all it is. Okay, and we can talk about how much resistance and how many reps and sets and all that. That becomes more prescription. Depending on the individual, we'll prescribe different things, but that's important. But also, if you don't have any of these things, your body weight, respectively, is resistance. Okay, it's weight. And so if you're standing up from a chair and sitting down, if you do that 5 times, that's an exercise. Okay, that's 5 times sit to stand, for example. If you just kick your leg up, your leg will have some weight, and you just hold that up for a second. That's resistance as well. All right, so it can be using your own body weight, or can be external resistance. So dumbbells, therabands, all sorts of things. Kettlebells.
So like if you can't walk a lot,
Yep.
like, you can do those different types of exercises.
Yes. Yeah. Correct. Yeah. That all makes sense. Any other questions about that while we're on the exercises? Cool. And so, by the way, so I would say those are 3 separate categories, and I encourage sort of take a bit from each. Oftentimes what we find is people don't really know that much about core activation. They do the walking stuff. And so oftentimes when I ask people, what do you do? And as we sort of heard in the room as well, I go for a walk, right? Or I go for a swim, or I'm doing some other form of cardiovascular exercise, okay? What usually is missing is the activation piece and then the strengthening piece. And that's what we like to add in, because when you do that well, that's what builds your strength, builds your movement confidence, all right? But also, walking is good. All right, so we're almost there. Here's a little time frame of when to start exercise. If anybody is super early out of surgery, first 6 weeks we recommend start moving. So I do encourage get started, but don't go too hard because you are still healing at that time. Okay, so there's a lot of healing going on within the first 6 weeks. And so you're focusing on recovery and light mobility. So maybe short daily walks. As I said, start breathing and start walking would be good things to do. And you're really avoiding anything more significant. Okay. Once you get to 6 to 12, that's probably a good time to see someone like myself and to start building that foundation. That's where we can really go into that core activation piece properly, and then functional movements, things like sit to stands, picking things up and things like that. All right. We're still avoiding crunches and heavy lifting and breath holding. And then 12 weeks on, assuming you've built the foundation, then you can really go a bit, I wouldn't say go harder, but you can build on it. You can increase your strength and confidence. So you're progressing that core stuff and you're progressing general strength stuff. All right, so last couple of things. Here's some general tips. Start slow, listen to your body, stay hydrated. So it's particularly for people with, especially if you're ileostomies or even urostomies, bear in mind, your part of the role of the bowels is that digestion piece, especially the water absorption. Okay, so if that's missing, you just have to be extra careful about hydration. Okay, and then when you're exercising, you're going to be sweating. So again, you have to be extra careful about hydration. So comfortable clothing, consider support garments. Now, I don't claim to know too much about them, but you've got some lovely ladies that will talk to you about that. That can help. So especially if you're sort of a bit anxious or not sure, having that little bit of extra support to get started. And you probably know this more than I do, but I only realized recently they come in different strengths. So there's different grades of support garments. So you might have an everyday one where you go, all right, I'm going for a walk, but now I'm going to go see an exercise physiologist. Let me put on grade 4 or however you call it. Is that fair?
5.
5. There you go. All right, so then, and obviously modify movements to reduce risk. That's things like, I'll give you an example of that. Recently I was talking to a stoma patient who, he came up with an exercise before seeing me, lying on the floor with 2 4-kilo dumbbells, lifting his arms by his side, and then lift and coming back up again, right? This is what we call a chest fly or pec fly. Cut to chest muscles if you're a bodybuilder. I listen to that and think that's a lot of risk for not a lot of reward, okay? And so if you want to strengthen your chest, the suggestion I gave him was if you go, because he goes to the gym. So you sit down, there's a chest press machine. So you're sitting down, backs up against the backrest, you activate your core correctly, and all you're doing is pushing. You'll feel that in your chest. If you have your arm positioned that way, it'll be more chest. If it's that way, it'll be more triceps and arms, but a little bit of chest. Much less risk and probably the same amount of reward. Okay, so that's just what I mean by modified movements. And I appreciate, you may not have the context. That's where it's worth seeing an exercise physiologist. Okay, consult healthcare professionals and beware of online advice. So I don't put a red cross there because I think there is some useful stuff online, but you just have to be very careful. Okay, and even, by the way, so some of my clients have told me some stoma, people that are marketing a stoma exercises may or may not be appropriate. Okay, so I've just come across that as well recently. But no one in the room is YouTubing, which is somewhat surprising, but also I guess that's fine. So we're all good. So that's pretty much it. So I'll take questions, but I will ask, if you guys don't mind, there's QR codes on the flyers you guys got, or you can just take a scan of that. There's a short survey, and that really helps me to get some feedback for how useful this was. So hopefully this was useful, but I'll find out soon enough. All right, so that won't take you more than a minute, and once you've done that, if you don't mind, yeah, why not? It won't take you more than a minute, but also happy to take some questions, assuming we've got time.